Is this a video?
It's a padded cell.
Yeah. It's blinged out because we're
they took
snowflakes.
the straitjackets off.
Let's start with that. Start by explaining, like, what it is that you each do and how that relates to kind of like what we're talking about here.
Well, I mean, so the military asks you to do things that really no civilian job's ever going to, maybe unless you're a first responder, and they ask you to be away from your family for months or years at a time. You're put under really high pressure situations, even during exercises where it's hypothetical, like things are blowing up around you, like literally. And then some of the people we work with, I mean, helicopter crashes overseas and special operations, they do a lot of things in places we don't know about. They're special operations, right? Or nobody else knows about. And everybody has their crazy scars. Like I think we're used to hearing the stories of the things that people in the military deal with, and it's like every day for us. So, and then some of the issues, I think too, there's a lot of, I would say, frat boy.
So I think,
what?
Yeah, no, you're absolutely right. I think we take a lot of it for granted, though, being in it. You don't really understand what's going on or what you're exposed to until you have the moment to decompress and take a look from behind it.
Well, and most of us, like, we're 18, 19, 20 years old. We don't know what's a normal adult life and what's not.
Right.
And then you've got the stigma when you're in the military. Well, that's twofold: a professional stigma of if you get mental health assistance while you're in, it can affect your career. If you're a flying officer, meaning rated officer, meaning you fly aircraft or operate in an air crew, they can take away your flying status. It can take away your ability to carry a weapon, and if you can't carry a weapon, you're not deployable. Like, this is your career and your life and your money and your life insurance and your health insurance and everything else. So you have that stigma, and then you also have the stigma of we're all supposed to be tough and we're military. Like, I still act. Everybody still acts like that. Like, we got this. It's fine. We're fine.
I mean, it's from the top down. What's the line of words without actions is death? Or acts, whatever. It's the thing in the military. It's the open secret where we have mental challenges, where we have moments of depression, sadness, whatever you want to call it. Whether that's cause.
I mean, the divorce rate's huge. We know divorce. How stressful is that?
And it's the hidden secret. It's the stigma is consistently there of you fake being okay just so you can continue getting your paycheck.
Right.
Yes. And I mean, things like
that sounds so counterproductive too. Like, because now you're not dealing with a problem that you have, which is just going to exacerbate the problem. So now you get, like, if you're concerned about somebody's mental health and they're not dealing with it and that's getting worse, but you're still allowing them to, like, carry a weapon or fly or whatever.
Right.
Because they're not going to deal with it.
That would be the kind of thing you'd want to handle.
Yes.
But think of how they do handle it without, like, the help. Without the help, it's alcohol. It's, fighting,
alcoholism is rampant. Divorce is rampant. Spousal abuse is rampant.
It's rape. It's all of that. All those I don't know what second order effects, if you will, for those type of being under that kind of stress, pressure, depression, all of it. The mental thing isn't there. I mean, it's a bumper sticker. It's the we care, but without the actions of, like, I don't know. It's, to me, one of the things that really clicked, just this is as government civilian, was the people over me have some of the same challenges that we have, right? Like, so we had a SES who, what do you call it? They're civilians, but they're equivalent to, like, a general.
Generals.
And, you know, he actually got up in front of everybody and talked like about his struggles. Like, hey, you know, I was going through a divorce. I had challenging times.
He was still going through a divorce.
He was still going
just went through it. Yeah. Something.
And it's the connection piece that is so often overlooked. That's super important, that you're not alone. I think that's the biggest challenge of military side of it is, you know, like you started talking about, it's a frat boy culture.
Suicide rates are rampant. Look up suicide, look up military suicide rates in comparison to civilian. Mm-hmm. It's crazy. I think we all know somebody who's committed suicide or freaking killed themselves in a second order way by drunk driving. This huge like it's a culture, like you said, and yes, that, and then there's just elements of being that are great, right? The camaraderie and there are things I would never take back, and I'd never change my military service. Like it made me who I am, but it there's the opposite of that too, or the other effect of it's frat boy, it's I wouldn't say frat girl just because there's not really that many of us, but the trying to fit in.
The frat girls are the trying to fit in.
Yeah, the guys they'll do crazy stuff. I mean, they're just great. I mean, they'll jump off, you know, they're the kind of guys that are going to jump off a second-story balcony into a swimming pool or a bunch of bushes when they're drunk because it's fun.
So my tech sergeant, who was a supervisor, we were in the dorms. It's total offside story on here. So they were going through this conversion of dorms, right? And so all the beds, all the mattresses, right? We're getting rid of them. They're going away. So drunk night after the club, stacking mattresses down on the first floor while like I got this, jumping off the third floor onto mattresses. Like that's the kind of, you know, you think it's Animal House, it's funny, but I mean, you're talking also like the hidden part of it. Like, why are we doing this? This was a guy who's a supervisor, tech sergeant, in charge of, I don't know, maybe 25 folks, right? He's got a wife at home. He's out on a Friday night drinking it up and jumping off balconies. Because of why? What's the real thing, you know?
Well, and then you have some of these people, I want to call them airmen because we're Air Force, but
Guardian.
They jump out of like their jobs. They jump out of planes. They shoot. They bomb things. They practice like they play. That's what they do all the time. So they're always operating at this high level. I mean, Chris was security forces, same thing. This high like alert level, and then in any normal circumstances, we don't normalize. I have a hard time sitting still. You know, that's Chris can attest to that because it drives him crazy. And you know what sucks is that for me to sit still, I better like get a glass of wine because that's the only way I'm gonna like calm down enough to be able to sit still. Always alert, never want your back to the door. And I don't even know the guys. I mean, you know, our jobs were quote fairly normal or maybe a little lower key for military. But some of these guys that I work with now that are these special ops guys, I'm like, how do you live a normal life? It's like the doctor, you think, how did you watch 5 patients code today? And you have to go home and pretend to be a normal husband. And how did you, you know, the cop who showed up and found a, you know, dead baby at an accident? Like how do you normalize after that?
Like, how do you like compartmentalize the work between a home life? It's a weird balance. And it doesn't sound like there's any sort of like mechanism or means to help make that transition. You just kind of got to do it. And some people can do it better than others.
Yeah. So, I mean, that's it. Spot on. I mean, there really isn't. I mean, they try to do that, I think, in deployments of like, you know,
they have mental health screenings.
And
have you thought about suicide in the last 15 days? I mean, shit, you can just.
But you're gonna say no.
right. And so I mean, if you're thinking it's this frat boy environment, so think about it. You know, you're all buddies and all that shit. Nobody wants to display any weakness. There is no weakness. There is no, hey, you know, I got to take a time out because I'm like mentally fucked.
And that's in the male environment. And then as a female, you're sitting there with 100 guys and the one female. And the moment you display weakness is the moment they start talking shit about you or giving you a hard time. Or
they'll like vultures.
Yeah.
Yes. Yeah. And not anything. It's just the culture. It's just the way it is. It's just one woman with a bunch of men. You stand out. And so anything you do stands out. And you would be that typical woman if you expressed any kind of emotion.
Yep.
Negative emotion or you can't do that like as a female, because they'll be like, that's a typical woman, or it's and they'll make fun of you to your face too. Like, so I've seen it and I was like, I'm not saying nothing. Especially when I was young. It's not so bad now, but when we were young and we were in the military and enlisted, it was different. What are you listening to the dog?
Yeah, I'm listening to the dogs. I'm having a conversation. All I can hear is dogs.
Different than it is now as an officer, and the higher level jobs. It's different, but those low level jobs, it's like, it's rough. And then everybody comes in at a low level, so then you deal with all that, and then we become the leaders. And we've still never dealt with our mental illness.
Right. But then too, because of that culture, I mean, there's not much you can do to like just on your own change that. You still have to maintain that status quo.
You have to, if you're on any kind of mental health medications, you're evaluated like once a year. So even if I went to like a psychiatrist and I paid for it out of pocket, if I get Cimbalta or something prescribed, like then the military doctor picks up on that during your annual physical and will what they call med board you, send you to a medical board, if you're on that for over a year. Like they have certain regulations. It's just like pain meds. If you're on pain medication for over a year, they automatically med board you. So they're not only screwing up your mind being in the military, but you're screwing up your body, and you can't even take pain medications because, again, you'll get kicked out. So we all just kind of deal with it until we don't have to deal with it anymore. And then you retire, and really all well and good. They make you go through hell to get any kind of mental health disability. So you get out and you think I can finally get help. And the first thing you do when you get out, or, me, I have it and I'm still in actually, but, you go through a process to get evaluated for a disability, and the physical disabilities are pretty cut and dry, right? What's in your medical record? What can they physically see you do, etc. Now the mental health issue is not so cut and dry. And so there's my dog. Did you let him out?
I did. I just got tired of hearing him.
Is this my emotional support animal, Owen, my baby? So if you claim any kind of like mental health stuff, I mean, they sent me, and there was stuff in my records. Like it was all there in my records. I went to 3 psychiatrists to be evaluated and had to tell the same story over and over and over. By the third guy, I'm just sitting there with the paper he handed me, and tears are pouring down my face. And I'm like, why are they making me do this again? He's like, you know what? I'm just going to copy paste what the last guy said, because you seem pretty legit and didn't make me go through it again. But 3 times. So you go through hell, and you get your VA disability rating. So that means you can go to the VA hospital to get medical care. And mental health, that includes mental health, dental, vision, whatever. To even get seen in the mental health clinic is probably average between here in Oklahoma, 3-month process.
3 months.
3 months to get initially seen.
So, I mean,
intake is what they call it.
Intake. So mine was like the VA kind of stuff, right? Mental health, right? I'm disabled vet. I've been out for God knows how long. So trouble with Baxter and depression and PTSD, and I hit low point, like bad low point. Like there was shit going on. Like I'm okay. Like I can compartmentalize like one thing. Let's say the work sucks. Okay, got it. Great, good. Compartmentalize. You do work, then you add on family, then you add on finances, or you add on whatever, the divorce. You add all those together, and that's a clusterfuck. And it's like, I'm not mentally equipped to handle all those things on top of me at once. So I hit a low point, and I'm like, okay, well, I'm going to go to the VA, you know, I'm going to be proactive. I'm not going to, you know, like, what's the word I'm looking for? I'm not going
tough it out.
I'm not going to tough it out. I'm not going to just curl up in the bed. I'm going to be proactive and do something. Something's not right with me. I know I'm in a bad place. I need help. Like making that realization and then going out and doing it. And then you go out and do it, and they're like, yeah, that was just the intake part, and you're going to have to come back.
We'll have a social worker call you, and then you have to tell your story again. And then the social worker determines what kind of doctor you need to see. And then eventually that doctor's office calls you to make an appointment, you hope. And then you get seen for the first time. And the guy, you have to tell for the third time, you have to tell the whole thing over, because they don't apparently keep any records of what you have ever said in the past.
Yeah.
Right. So for me, it's like I go to this one guy, and this was the last time I went in person in Oklahoma City. It was okay. This was my third therapist, doctor, whatever you want to call it. Third one, right? First one was like, yeah, great story. You've already told your story. What's going on, your mental conditions, to one person. They're like, okay, we don't know if we can help you. We're going to give you to this guy. This guy, he talks to you. He's like, no bullshit. He seemed all right. Next guy, I walk in, no shit. He goes, who are you and why are you here? Like, you know, like seriously? Like, come on. And then, so, you know, you tell your story, you talk to him, whatever. I'm honestly, it's like he lost me at, you know, when you're trying to build like trust.
Right.
The first thing is saying, who are you? Why are you here? Just out the door. So he prescribes me an antidepressant psychotic. He goes, yeah, normally it's used for schizophrenics. Schizophrenia. But don't worry about that. I'm just going to give you a little bit of a dose and just tell me what it's going to do for you. So, yeah, it's like, I'm good.
Oh, here, they gave me Cimbalta, which I have situational anxiety. Yeah, I'm kind of high strung all the time, but like there are points in time where it explodes, like it gets to be too much, whatever that means.
Yeah, you reach a threshold where it's just, yeah.
Like certain like raised male voices is something that really bothers me, or now airplane turbulence, which was because I fell out of the sky one time. But anyway.
Because you're an angel?
Yes.
Okay.
Something, there's a traumatic event.
Well played, Chris. Well played.
Yeah, not anything I can handle, my body automatically starts reacting to it, like an anxiety attack. So I've had anxiety attacks, right? And I can't control those. So very much situational episodes, and not super frequent or anything.
No.
Depends on my level of stress. So stress will get me there too. Flashbacks, and I've had those where I black out and I don't know what's happening. Yeah. So I'm trusting in this VA doctor who, by the way, is so old, writes the prescription wrong. And the pharmacist downstairs had to be like, yeah, I didn't think he meant that dosage. We get stuff from him wrong all the time. Here's what you need. Like, and they just fix it. They just do it.
Yeah. She took it and walked backwards for 3 weeks. It was fine. No big deal.
So it was Cimbalta, which now I don't know. I'm just trusting the doctor. I'm gonna do what he says. Take it for this long. Well, one, it did really nothing for me at all. Like I still had the moments of situational anxiety. Like what I need is what's that stuff? Xanax, right? So something to pop, something quick reacting for when
right.
When there's moments.
I'm a fan.
You know?
Yeah, right. Yeah.
But no, they give me this Cimbalta shit that doesn't do anything. And then I'm like, oh, I just kind of keep taking it, along with my vitamins and my blood pressure medication every day. And then my hair starts falling out. Like I've lost half my hair. Like, do you see this? I used to have a lot of hair. And I'm like, oh my God, something's wrong with me. Like hormones.
You just wanted to show them your hair.
It's not pretty right now. Hormones. So I go to the VA doctor because they're so awesome too. in my intake appointment, she runs all the blood tests, hormone levels. She's like, oh, you're pretty fine. You're kind of low in vitamin D. Here's a vitamin D supplement. Well, one of the other guys I work with has been on Cimbalta, tried to get off of it. It's like, I had no idea any of this. It's super addictive. He's trying to get off it, and he's having what they call brain zaps and like shaking and all this stuff. And he's somebody I work with. And I was like, I was like, oh, I have this stuff. And he said, that is Cimbalta, because I had the generic. And he's like, man, I don't know if I'm going to make it through this. And he ended up getting back on it. And I was like, what the hell? So I look up side effects of Cimbalta, and hair loss is a very common side effect of any antidepressant, but in particular Cimbalta. So I went to this. So first of all, I got prescribed something that really isn't
wasn't useful.
Wasn't for me. And then my hair starts falling out. I go to somebody who's a doctor who has a list of my medications and should know common side effects. Is, hey, let me look at your medication. This medication could be causing you hair loss. No, freaking Dr. Google. Dr. Google told me I couldn't contact anybody at the mental health clinic, get anybody to call me back. Like, I want off of this stuff, but you have to wean yourself off, because if you don't wean yourself off, the horrible withdrawal symptoms can last up to 6 months.
Yep.
So I had to, then nobody would call me back. So then I had to research myself of how to wean yourself off Cimbalta. And I had to go through a process. And the days, it was like an every other day thing. And I mean, taking little pebbles out of the pills, you know, so you just reduce the amount you got every day. And then I got the brain zaps for, I don't know, 3 weeks, maybe 3 or 4 weeks. It was like these, I was in a, like it felt like you were hung over horribly and still drunk. Like, so bad.
It's the, what do you call it? It's like you're weaning yourself off like you're a addict.
And next time I go, I have a mental health appointment, I think next week is finally, all right, we've been here since September. We immediately got in with the VA to make sure we had medical care. Which, by the way, the state VAs don't talk to each other. So we had to like get all redone here. Oh, they can't even pull medical records. They have to request them. So I finally, it's been 4 months, have my mental health appointment next week. And I guarantee you they're going to want to prescribe me something else.
Yeah. Oh, absolutely.
It's always it's always, well, why don't you try this? This may help. Like, it's not counseling. And if you go to counseling, then they don't even remember who you are the next time. And they switch doctors on you.
You're not going to the same person every time. You're not going to get assigned a counselor, a therapist, or psychiatrist, or anything like that.
You're supposed to.
Right.
I've never seen the same one twice.
Yeah, you're supposed to, but no. I mean, that's not how it is. And then it's like, so either they're overtaxed or something. So you might not see the same person, but then your next appointment will be like 6 months from now.
Their turnover is crazy.
And it's like, well, I don't know. If you've ever been in therapy, or if you've ever had like there's that trust issue, there's that connection. Like, if you don't have that with a therapist, you need another therapist. Like, you're going to talk about certain things that are personal, and for you to actually like get some use out of it, you have to open up. And if you're switching over and over, somebody new, some different phase, you've told your story like 8 different times to 8 different people, you just get calloused by it. And is that real? I mean, in a way, okay, that might be a little therapeutic, but is that really the intent?
Already coming from an environment that kind of like inhibits you talking about that stuff in the first place.
That you are absolutely right. You are frowned upon and limited to talk about it to begin with. And then when you finally get out and you're ready to talk, or you've reached rock bottom and you have to talk, there's not that support outlet to kind of do it.
I mean, I've kind of come to the conclusion, at least about myself, that I'm fucked up, and nothing I do I've tried, nothing I do is fixing that. So I'm just fucked up for the rest of my life, and I'll deal with it the best I can. And poor Chris will deal with it the best he can. I'm more that anxiety. He's more the depression side of things. So that always goes over well. I'm my strong, and he's like, leave me alone.
Martin and Lewis, anxiety and depression.
Right, it's like a little bit country, a little bit rock and roll. It's like the degree that, I mean, when people like really need that help and it's available.
Yeah.
Yes.
But it's not available.
It's not accessible.
Like any helpful means.
Yeah, and they're pretty much a pharmaceutical.
That's that I think
That's what they.
that's the
what they do.
biggest thing.
And
So
that's
so
what
like,
happens too. If you come in with something, it's like, well, here, pop this in your
yeah,
mouth.
Prescribe,
yes, that's exactly what it is. So
Pill factory.
so every time I've gone to the VA, and I've also, so I did go to on base like when, on base doctors, same type of thing. It was, let's put you on this, let's put you on this, let's put you on this. And there was a time where I'm driving down the road, I'm on whatever drug it was. Well, one drug made me have like really bad headaches. I was like, yeah, hell with that. And then the other one, I'm a zombie. I'm like staring at a beautiful sunrise. I feel absolutely nothing. So it's like the treatment is worse than the cure, and
Right.
all it is, we're just going to continue to write scripts until you smile again. And it's like, are you shitting me? Like
we get to the root cause and help me come up with some coping mechanisms that aren't alcohol.
Right.
Really
Yeah.
Yeah, and
I think
that's what's so weird about it too, is that you're coming from an environment where, showing, any sort of like weakness, is frowned upon. So instead of turning to, say, drugs and alcohol, the way they treat it is with drugs.
Yes.
Yes.
They're controlling the drugs you're taking instead of you. And
right.
Yes.
How is that better, especially if they're just kind of like doing it and not having any sort of like follow up with how it's working with you or communicating with each other, or
no, they do 6 months after they prescribe something. Sometimes they'll follow up. 6 months.
I think you kind of hit it.
But then it's never. But it's like you said, it's not the same person following up,
right?
And it could just simply be someone that's like, "So how you doing?"
Yeah. I feel like every time you're just reviewing my record again, to figure out who I am, and it's like, oh my God, what am I doing? It's like Groundhog Day every time I go to mental health with the VA.
Yeah, I don't know. I think sometimes it's, there's a lot of us who are disabled vets. There's a lot of us who have the mental issues as vets, and we know what each of us goes through. Right. And like, there's that kind of connection with it, and it's we're all closed off. I think the biggest thing we had a retreat that we went to in Angel Fire, and there was a guy who was in the Army, right? Of all things, Army. I'm not Army, and they're crazy, whatever. And he had some of the same exact experiences with depression and issues that I did, and I went through the military, 20 years after him in a different branch of service. So I think part of solution sets are when you're talking about groups or connections, or I mean, I'm sure there's a lot of them out there.
Well, I mean, here, that retreat.
Yeah.
Was a.
Uh-oh.
Oh no. Hold on. Fine. There we go. Sorry.
Yeah, we got a telephone call technology.
That retreat was more helpful and healing than anything I've certainly ever done with the military or VA. And I did go to counseling as well while active duty, and that was pointless.
So
but
okay,
it was,
so
they're run by
retreat though?
So they're civilian groups. They're not related to the military. So they're related. Just good people starting programs and raising money and
it was like a veterans association of some kind, and that's all they just did. Hey, we're gonna have a retreat. It's for disabled vets and their families, and
they do it every year. I mean, they have one that's free if you go during the summer, where it's all you got to do is get there and everything's free, and they fund everything. Now, why doesn't the VA do something like that? Because everybody's sitting in that room crying and emotional and really feeling they're letting something out that they've been keeping in for years, and that's all it took was somebody talking, somebody the sharing, the commonalities, not being stuck in some sterile room with some guy who doesn't even know who you are again? And you're just a file.
What are you doing here? Yeah.
What are you doing here?
Yeah, they look at your percentage of disability. I mean, that's.
I see here that you have some depression. Can you tell me about it?
Yeah, so maybe the solution set could be in wherever they're funneling money into all these pharmaceuticals. Maybe start doing some of these things that are working on other fronts with civilian organizations that are really helping veterans, and
Right.
and they'll let you go as many times as you want, and they're all over the United States, just a matter of finding out where they are. So I'm like part of Facebook groups that are for disabled vets and stuff, and people post on there, so you get it. But I'm grateful for the VA compensation, and I'm grateful that I never have to pay medical insurance because you can get your prescriptions mailed to you, so that's good.
Except for Xanax.
I forgot where I was going with that. I also have
I just keep thinking
adult
Xanax.
ADHD. I do, but I think they could do more things to really get to root cause and get people to let these emotions out and make you feel that it's okay, because it's also different if you're sitting. It's hard to even relate to civilians.
Yes.
It's much easier if you're with a group of military, just because, like you said, there's you automatically have something in common.
Right. Well, yeah, you have a common language, you have a common frame of reference, and when you're talking to civilians, there's also like a civilian perception of people in the military.
Right.
Yes. Yeah, I definitely scare people sometimes, civilians. like they're not used to my. I can be very forward and upfront.
It's also so for me. It's also hard because it's hard for me to recognize between civilian and military. Like my frame of mind, how I think is I've been in the military for 4 years. I've been in civil service for how long, right? Always around that military. So to me, if I have somebody who hasn't been in the military, it doesn't compute. Why don't they have the same frame of mind?
No, it's true. Yeah, I still use acronyms that people are like, I have no idea what you're talking about.
Why don't you understand what I'm saying? What I think the problem is I think everybody's been in the military now. So congratulations, everybody.
How would you breach that culture though? Because if that culture is so inbred that you don't show weakness, you don't admit that you have problems, even though clearly so many people do, so many people are trying to get help, so many people are being medicated, and if they're not being medicated through either the military, they're self-medicating. I mean, it's one of those things, like an open secret kind of thing. So
it is. It really is.
How do you breach that wall to actually just eventually address it? Or, I mean, not like I'm expecting you to come up with a solution now, but is that ever even?
I'm glad you asked. I took notes. So let me break it out.
I have some notes.
So I think the younger generation, I know people say all kinds of crap about them, but I think they're a little more accepting. They're less sexist. They're less racist. They're less, and just all around more accepting of everything, really. I feel like there's not as much stigma there. The problem is that the leaders, who are currently in leadership positions, that's unfortunately how we were raised and how we think. Not all of us, but
so you're right.
It's almost an automatic thought. It's generational. So what are we passing down? And it's times when I go into these.
It's like the two of you. You're in a group. You're kind of stuck in that middle.
Right.
We're in. You have the awareness, and you have the and you know what tools you need and everything like that. But to help, what's below you. But coming from above, you can't do that.
No. So I mean, it's really big generational diversity. I mean, when you talk about the different generations, when you're talking, it's the baby boomer type generation of my parents, and then. Who was after the
Generation X?
Yeah, well, I'm more Generation X. Anyway, that kind of
right after the boomers.
Well, what's after the boomers?
I don't know.
Anyway,
I'm not one.
Generation X, and I feel like there's something in. Oh no, because I'm. I think you're right. Maybe I am right after the boomers.
Yeah. So more of the boomer. So I mean, we're still in that kind of boomers are in charge phase, and the boomer in charge phase is very much that boys will be boys. Very much that
suck it up,
very much that homosexuality bad, alcohol, drugs bad, and expressing your feelings, you are a snowflake. Is that good?
Yeah,
is that close enough?
we defined
Okay,
snowflake earlier. Yes.
Anyway, so those are the folks in charge, and for them to, and some of them to Generation X somewhat, because I consider myself more of the Generation X. We're in that stuck in the middle frame of what you're saying, like where you're millennials, where everybody has that term for millennials, they're bad, slackers, whatever. Maybe they're just more in touch with what, socially is important to them. Like they might have different values. And when you're talking about, like, we don't care about sex, race, creed, or we're focused on mental health and things like that as a different generation. Maybe that's how things turn the tide. But I think the biggest thing is what you said too, is like, it has to start top down is one thing that has to happen. When you have folks who are leading from higher level positions, if they're really interested in mental health, share your story. If you're really interested in mental health, make it okay for me to tell you. Anyway, distractions.
Dang it, ADHD. I had a point I was going to make up.
9 kids, 8
But
dogs.
Then you said it was like that one leader who like actually got up and started talking about his divorce. He was going through.
I knew him for like 2 years. He never said a word. If he would have said one thing, because I was going through this shit. We're all connected in some way,
right.
We all have very similar stories. It definitely is. That you are not alone, we are not alone type of thing. That's a real thing. Commonalities link us together, but that would have helped me. Just somebody, hey, look, I'm this guy. I make a hell of a lot of money. I'm a 2-star general equivalent. Like, I'm going through the same shit that you are, my like low subordinate, and that would have helped me throughout a day.
And so I think, so we have things like mental health days you can take now. They make fun because it's not in the Air Force. In the Army, there's a real thing. It has you have a mental health break card. Like if you're
we make fun of that shit all the time.
Yeah, it's a joke.
It is a joke. I feel
mental
health. Yeah.
Because you get yelled at and you get dropped and you're exhausted and they purposely put you under mental stress so you can learn how to operate under that basic training. And so now there's timeout cards. Now we're making fun. We
are.
And
absolutely.
Should we?
No.
I know now as a an almost 40-year-old woman that I wish I had mental health cards for life. Like that when I felt like it was getting too much. I had a moment yesterday where I was in tears because I was becoming overwhelmed, and I just need that card.
I gave you multiple ways. I gave you multiple suggestions. First suggestion: when you become overwhelmed, it's Curly from City Slickers. It's the one thing. You just focus.
Yeah.
You focus on the one thing. You just keep doing that one thing. You were singing the Frozen 2, Anna's thing of, do the
one step.
One Revenge of the Nerds is the other one. So Anna's thing was, do the next right thing. You just keep doing the next right thing. And then Revenge of the Nerds, you got to put one step, but you got to put one foot in front of the other. Yeah. So anyway, there's your movie trivia for today. And the whole point is overwhelmed, just take it one step at a time.
Yeah. Changing the culture is going to be a battle, but I think it's going to take a couple just generational shifts. I don't think there's too much we can unfortunately do about it. They keep trying to do things,
and we all make fun of it.
And it's a joke. Like they want to have suicide awareness, and there's been 10 suicides this month, and so now everybody's going to take a suicide awareness day, and then the mandatory training is a freaking joke done by idiots who haven't done any of their research or know any of the stats or really know how to help anybody. They're just another GS employee, civilian government employee like me, who got tasked to do the training.
Right.
I'll tell you one story. I know we're kind of just like all over the place, but this is fun.
It's pretty simple.
So anyway, tell them exactly what she's talking about. It's the mandatory. We're going to shut down. We're going to shut down the office or whatever.
Yeah, you hold it.
I'll hold it for a while. All right. So we're going to shut down the office for a while, and we're going to talk about, suicide awareness and things like that as an entire squadron at the time where I was at, right? And so we went to the zoo, Oklahoma City Zoo. It was, we're going to have a picnic, we're going to talk about stuff, everything, right? And so we did that. And then the questions come in, how long do I got to stay here before I can go home? Then the questions came in, like seriously, and okay, I can tour this for a little while, and now when can I go home? And then the thing that struck me is, here's what we're here for, right? We are here for mental health, all that, all of it. And there was a lady who was in the office who actually opened up and was starting to have conversations about how she's overwhelmed, etc., and things like that. Long story short, everybody left her. Done. I mean, when I say, words without actions and things like that, like, you are here for mental health day. There's somebody who actually needed help, and everybody just, like, it's lip service. Everybody just took off, left that person alone. No, like, hey, we care about you. No, hey, let's come off to the side, let's talk. Or, hey, I was going through that too, I get it. Nothing. It was just, we're all involved in our own little
and you do something like that, it becomes like theater. It's like, look, we're doing something to show that we're going to do it. But okay, let's all go to the zoo and let's have a picnic. Chances are most people there, one, are of the mindset of like, I'm going to be tough and deal with it, and I'll compartmentalize it back here. Others like, I got shit to do back in my office. I can't take the, but so now I've got to go along with this. Like, unless they're in the frame of mind to want to be there, it's completely counterproductive and a waste of time.
Well, I have two stories when you talk about the military trying to do something. One time we have chaplains that are available, and you're supposed to be able to go. Go to the chaplains anytime. And it was when I was going through the divorce, and the assault, and I was going through all the JAG legal stuff and the interviews over and over, and the cop interviews and the detective interviews and the military lawyers interviews, and I had a moment, and I was going into work, and I was like, you know what, I need to go see the chaplain. Like, I felt hopeless.
I remember that.
I didn't know, there's nowhere else that we can just pop in and go and get help other than the chaplain. So I go to the chaplain. I text my supervisor. Oh, I'm going to plug in my phone. And I let him know I'm going to go see the chaplain. I'm not doing well. And then I got talked to later. I got not quite, I would say, in trouble. Ostracized, a reprimand.
Almost like
for going to the chaplain when I was feeling like almost to the point of suicidal. Like, that was probably, this one's not the lowest point. So that's one. And that was a military supervisor, prior officer.
There you go.
Is it working?
Yes.
Okay. And then the other one was not that long ago. We had another mental health day, and they're like, oh, we're going to do these small groups, and we're going to put you with random people in small groups. And so one of the things that our 3-star had done earlier that year, this last year, right before COVID, was take away the PT that we were allowed to do. And a lot of us use PT, especially military. And you're talking about government employees. Right. So we're not just talking about military, but government employees are a bunch of retired military people or separated military people. Right. That's who goes on and be what they call, GS employees or government contractors. We're all retired military or separated military. So we're all kind of messed up mentally anyway, government workers in general. And so they took away the PT, and that's how a lot of us deal with stress and getting out stress and like this anxiousness and anxiety, the physical activity.
Walk around, run.
Right. Yeah. I would just get up from my desk and go walk the mile loop in the depot, warehouse where they build the airplanes, just to get out that physical energy. So we took that PT away, and I don't remember how it came up, but we're in this group that's supposed to be talking about resilience. And, suicide awareness, resilience, how to help your, be wingmen. So they call them in the Air Force, wingmen. You're supposed to take care of each other and your team. And there's all ranks in there, from probably GS 11, which is like lower, to a GS 15, who's pretty high. He's one step away from being that general equivalent.
He is now, by the way.
Ugh, and now he's a general officer equivalent.
Yes.
So I brought that up. We're talking about mental health, and I said, the PT, and the guy sitting across from me has the same issue as me, Carlos, and I worked with him. And man, this is a guy who, he got too stressed, he would drop and do push-ups, or like in the middle of a meeting. It didn't matter, because otherwise his doctor told him he was going to die of a heart attack by the time he was 40 if he didn't change his way of dealing with stress. And so he started working out, and he got really, pretty fit. And so that's how he dealt with stress. And the PT thing was something him and I both used to deal with stress. So I brought that up, and this now general equivalent looks at me and said, just like my kids, millennials just feel like they're entitled. We're entitled to work out time to improve our mental health, so we don't commit suicide, and we actually show up to our jobs.
Right. Or even just like to focus on your job.
Right.
Like how many studies are out there that show the benefits of giving your workers, some kind of physical activity time.
Right. It's mental, and
some of them pay for gym memberships. I mean, my corporation pays for gym memberships. That's a thing.
There's so many different studies, and there's even workforce engagement studies that talk about what people want in their jobs. Straight
from leadership, here we are opening up on this mental health day where everybody's supposed to be like supporting each other and being good wingmen, and the highest ranking person in the room shoots me down like that, like just an a-hole. And my boss looked at him, and I really like the boss I had at that time. I want to go back to work for him someday. And looked at him, and he stuck up for me. I can't remember what he said, but everybody was like, "What is your problem, dude?" And now that's the dude that got promoted.
That's
because
the dude
that's the mentality you need. Screw my family. I'll work 16-hour days. I'll answer phone calls at 1 a.m. I don't need to go to the doctor. I don't need to go see a psychiatrist. Like, why should you? And they expect the same thing of their people. So those are just two examples of how leaders in military, both civilian side and militarily, that's how they treat their people. Not all of them.
Oh no, that's it.
But you're gonna end up under somebody that thinks like that and treats you like that.
I've been with a lot of supervisors and a lot of folks, and I think I've only had one who wasn't like that, and that was because he was a veteran who was like 90% PTSD.
Yeah.
And that was it. That he was all about taking care of the people, because he understood it, coming from having gone through like deployments in Afghanistan and stuff like that. So he got it.
But a lot of us who are 90% PTSD or anxiety or depression, we're not the ones that are going to make it to those super high level jobs where you would really have the authority to change a culture and make a difference in a entire unit is what we call it. And I'm super curious, because here's what you're going to see. I said that culture and being ostracized for opening up about things or coming out about things. 9 out of 10 comments on there will be positive, but 1 out of 10, I guarantee you, blue comment on it will comment you weaklings, snowflakes.
Not like
that's not what they would say. But
like,
you weaklings, suck it up. You joined. You got the disability.
You know what you got yourself.
We'll get ostracized. I'll get ostracized.
I'll tell you, I've read this before. I'm reading it again. It's Stud Terkel's World War II book called The Good War. It's all oral histories, right? And it's folks who served either in the military or just during the time of war. So even if you're talking about civilians, like wives at home, kids, family members from different countries, anyway, all over the place. The Good War, Stud Terkel. Anyway, the point, what I was going with is the people in World War II going through World War II, they had depression, PTSD. You're seeing all these things. It's there, that's the greatest generation, toughest generation. They dealt with it. So for people to go deal with it, snowflake, no, we're just talking about it. Everybody else from wherever, World War II, greatest generation, they have it too. It's not a stigma. I'm less of a, I don't like to say it, but I'm less of a P word.
Yeah. I mean, like,
because I can say I've got, depression. I can say, I've been suicidal. I mean, I can say those type of things and it doesn't bother me. So, I mean, like, yeah, if you have the one negative person, let me know. And, we can talk about it.
I fully expect to get those comments, not just on this, but on like any of these videos too. But it's like, but especially in like this, like sort of conversation, anybody's going to like lash out at that. It's like, okay, how are you dealing with it?
Yeah.
Clearly you were dealing with something.
Out.
How much are you?
Yeah. That's it.
We know. I mean, shit. We've been there. Shit.
I mean, yeah, we talk about us, and at least our generation now in this generation is kind of willing to open up, at least now after the fact. I mean, Vietnam War era. I mean, you talk about World War II, but Vietnam, and those guys are still I mean, they're messed up, like 65, 70 years old.
Why do you think we have so much homelessness? I mean, in veterans, I mean, you're talking about like, it's a systemic problem. We all have it. I didn't see anybody blow up, but I can just imagine, like, you're talking World War II, Vietnam, Korea, I mean, Gulf War II, Afghanistan, and it's still that culture of we don't talk about it and they're messed up. And then how do you get anywhere?
And the VA makes it so hard.
Great bit on this where he talked about, like, when you're coming out of World War I and all the, mental issues you have coming out of that war, they came up with a term for it and they called it shell shock.
Mm-hmm. Right.
And then as things went on, they tried to soften that language until like it went over. Shell shock became, I can't remember the whole bit, but shell shock became stress, some kind of stress, but eventually it came to post-traumatic stress disorder.
Yeah.
And he said, I guarantee if we had still been calling it shell shock, most of the veterans probably would have gotten the attention they needed at the time.
That's probably accurate because you turn it into an acronym and it's a disorder. So there's something wrong with me.
We have these people who, not only does the VA make it hard when you're already in the system, it's hard to get in the system. And so you have these people who are mentally incapacitated to the point of they can't hold a job.
Yeah.
They're addicted to opioids, they're addicted to drugs, they're addicted to alcohol. There's no way these guys are even going to be able to get in the system to even think about getting help, to even think about getting prescribed a bunch of pills.
And it sounds like the system is almost even perpetuating that, because if, you want to, keep people, hey, deal with it yourself. So they're going to self-medicate, or you're just being, trying to be placed into a box. You have this, I'll prescribe you this. It's like one of those like charts where, okay, you have this much mental health problems, so we're going to put you here.
Yes.
And you find you become reliant on those medications. And I think there's probably some culpability there to help, between their own decisions and trying to help things and the fact that they're not getting the help that they need.
Yeah. Yeah. They just make it so hard, and there's just not the availability there. And it's such, I mean, it's an issue throughout our society in general, but it's such a poignant issue when you've done military service. And I can go down the street and make an appointment for counseling and get real help if I'm willing to pay out of pocket. But my quote entitlements of
how dare you, millennial entitled.
They call them entitlements of being able to go to the VA for mental health care is useless. It's useless. And in fact, for me, it's done more harm than good. I even think for you, with you, he came on that time, that doctor said that to you when you walked in of who are you and what are you here for? I mean, he came home so upset.
I was like, I'm done.
I mean, done. That's one step forward, two steps back at that point.
Yeah.
I don't know if we have solutions, just suggestions, and maybe I think our actions and how we treat others within our sphere, I mean, because so the things that we're talking to you about, there's no doubt in my mind that we have talked to other people, and we have within our sphere, our work sphere, our personal sphere, our social media sphere. For you, I like 3 people on my page. Who cares? But you know what I mean? It's like, I think, you start having that kind of groundswell of like, here's links, here's this person's story, here's resources that have helped, here's somewhere you can vent. Like, if you want to vent about all the VA gone wrong, here's a place you can do that. But I think, like, it's the connectedness, it's the stories. Even if I only, help out one person, that's one person who's not having a challenge.
And it's doing something like this. And this is why I jumped on, I want to do that. I don't know how we're going to do it. I'm going to ask Chris later. It'll be fine. Because sometimes all you can do is say your experience and call it like you see it. And hope somebody hears it, and hope somebody in a position that can do something, where there becomes enough advocates for change that we can change the culture, we can change the state of our mental health capabilities for veterans and what's available. So thank you for for doing this, because this is bringing awareness to the situation is mostly what we can do. I mean, what we're capable of doing right now.
I think it's what a lot of us are. It's about all we're capable of. So thank you for sharing this like really specifically unique perspective that you have, that I think a lot of people just don't see or get or understand.
Yeah. Absolutely. I'm interested to hear everybody else's, because I know we're all, I feel
like
we're all messed up in our own way.
What they think about our beds back.
Wait, is this a video?
It's a padded cell.
Yeah. It's blinged out because we're snowflakes.
They took the straight jackets off.
Those will come right back on as soon as the camera's on. I know. You got it.
The VA guy's in the corner.
Schizophrenic? What is it again?
Oh my gosh. Thank you guys so much. I appreciate this. This was great.
Hey everyone, thanks for watching. I really hope you got something out of this episode. If you like what we're doing, please be sure to like the video and subscribe to the channel. You know the drill. And if you don't like it, move on. Don't be mean in the comments. That just says more about you than it does about us. I'm sure there are one or two other things on YouTube you can troll. If you or someone you know is having suicidal thoughts, please, please, please call emergency services, call the National Suicide Prevention Hotline. Just call someone. You are not alone. You're going to get through this, and the world is a better place with you in it, whether you see it or not.